All right, so welcome everyone to another Herzog Law Firm webinar. This time, what we're talking about is how to not pay for services. And when I say we are going to talk about it, I'm lying. I mean, Kim Hance, our Aging Life Care Manager, is going to be discussing this with you. It's a lot of materials. Those materials will be available afterwards. We'll be emailing slides to all the viewers, and we will make the recording of the presentation available on our website. A little quick thing about Herzog Law Firm, we do lots of these webinars, and each month we have an entire week where at 2 p.m. every single day, we do a different topic. That is this week. And you could check out our website for the other topics. Every single Wednesday, regardless of week, we have a 10 a.m. and 2 p.m. webinar. Again, different topics, and all those webinars are available on demand on our website, herzoglaw.com. And we do consultations, 100% free, usually half hour to an hour. And I highly encourage all of you, regardless of what you get out of today, to have a more personalized encounter with the firm. Kim, on you.
All right. So good afternoon, everybody. As Dave said, I'm an aging life care manager, and a lot of times people wonder exactly what that is. To put it simply, I am a social worker that focuses my practice on all things aging and senior care, senior resources and things like that. So a big part of what I do here at the firm is work with our clients to help them understand what's out there, what's available, and then sort of how to navigate through all of those services. Today's presentation really is focused on a lot of the services that you can obtain without or minimal expense, and really things that you should be thinking about as you start to age, because as the numbers here show, it happens to all of us, right? We're all going to age, and the actual number of folks that are aging into the long-term care system right now between 2030, which is sort of the flux of the baby boomers, we're going to hit about 71 million seniors. So right now, resources are very scarce. And so as our seniors are aging more and more, we really want you all to be prepared for what's out there, what options there are, and where you would go to access some of those services. And when we're talking about long-term care planning, it really does include a wide range of services, and we'll be talking about a lot of those today. It's services such as help with everyday tasks, things that may help in supporting and managing an illness. Long-term care services really, when we switch over to needing care being provided for an extended period of time, when someone really is not able to do those everyday tasks for themselves. It can be provided in many settings. It can be provided in a home, a community site, a residential setting, nursing home. But as when we talk to our clients, most folks don't want to live in a nursing home. So we're going to talk about a lot of those options that can help. Again, when surveyed, and I'm sure the number of you guys here, if we were to ask you, aging in place, where would you want to be? Most people are going to raise their hands and say that they would like to, maintain their current residence. So there are lots of things to consider when we're talking about aging in place. And, one of the first and foremost is, where do you want to live? And, again, I said a majority of people will say, I want to stay right here in my home. So there's a lot of considerations that we have to take in to play with that. For example, is your bedroom upstairs or downstairs? Some of the other things to think about, though, include the width of doorways. Could they accommodate a walker or wheelchair? The height of the stove, cabinets. Is there proper lighting for the floors, surfaces, walls, things like that? These are all things that can pose really particular challenges and even safety concerns for folks, depending on someone's physical capability. So we really want to take into consideration all the things that might be needed in your current residence, should that be a place that you're planning on staying. One of the other things that we want to take into consideration is geographical location. As we know, the further rural, geographical area someone lives in, the less resources there are to pull from, finding caregivers, do you have family, friends in the area? So these are all things that we really want to investigate. Which leads us really to the next question: who's going to provide the care? And again, when we give the seminar live, the question we ask is, how many of you think your kids are going to be the ones taking care of you? Often we get a little bit of a laugh, and nobody really raised their hands. And it's not that we have bad children, it's just that the reality for caring for an aging loved one really can be very taxing, both physically, emotionally, and really even financially. This really is an honest conversation you need to have with your family members before, I can't express that enough, before assistance is needed. Alternatively, it's great to be able to research some in-home care providers, care coordinators, and some of the resources that are actually available to you in your area. Not every area is the same. They may say they have all of the same programs, but Albany is going to be much different than Saratoga County, is going to be much different than Washington, Warren, and then, up into the North Country. The same could be said for all of the services that are available downstate, New York City, Westchester County, things like that. So really have to understand what's out there and what's available. Of course, the $50 million question is, how are we going to pay for it? Care services really may cost more than you think. Between 50 and 70% of the people over the age of 65 will eventually need some significant help with their day-to-day tasks. And what does that mean? That means about an average of 44 hours of care per week out of 168-hour week. So 7 days a week, 24 hours a day equals 168 hours. So we're only talking about 44 of those hours, and that can cost about $5,200 a month. So as we start relating the numbers to what care it equates to, we really have to understand, what types of financial need you will have at some point. And then that kind of leads right into what are the financial resources that are available. And some will go into greater detail today in talking about those. So once we sort of establish for folks where they want to be, how we're going to provide the care, things like that, we want to really start developing a care plan. And really one of the biggest challenges of staying at home really is the risk of becoming isolated because of a physical decline, perhaps transportation issues. Seniors who want to stay in their own home really must find ways to continue to get it out into the community, to be able to socialize, nurture relationships with family, friends, loved ones, things like that. So we really want to understand what's available in your community to be able to do that. We had someone in our office the other day, and she and her husband live in a rural community, and they live on the outskirts of a rural community and literally have a mile-long driveway. So when we're talking about being able to have some social interaction for someone like that, it's not very easy. Then you have weather like we have in the lovely Northeast, it makes it much harder. So we want to really understand, are there community groups and senior centers out there? Are they running in-person programs, online programs, much like what you're watching today? What types of educational opportunities are out there? We're lucky we live in an area where Adirondack Community College offers classes that you can audit. There's the Academy for Lifelong Learning that you can sign into. A lot of the senior centers are offering currently online classes, particularly during the pandemic. Another option may be thinking about downsizing, but perhaps maybe moving to an independent living senior community, not nursing home, not assisted living, but really moving to a place where it's much easier to walk across the hallway to have tea with your neighbor than it is to bundle up, get the car out and drive somewhere. The next thing we want to understand when we're talking about a care plan is, what are the community supports and services available to you? One of the big things that becomes challenging for folks as we get older is the need or the ability to cook, right? So can we access Meals on Wheels? Is there someone that can help us maintain the house? And I'm talking about everything from plowing the driveway to raking the leaves in the fall, to mowing the grass, to fixing the gutter when it falls off, to repairing the stairwell that may have a broken step. So who's going to, manage the maintenance part of it? Financial maintenance becomes a big part too. There are the opportunities to, do you have children that are going to help you manage finances? Do you have a friend? Do you have a loved one? Or do we need to look at what professional services are out there? And then, we're going to talk about a little more formal services like respite and adult day programs that exist in the area. Then we're going to kind of talk about care. So care comes about incrementally usually. And when we're talking about care, there's different ways to break it out. So there's the actual hands-on care, and we talk about something called activities of daily living. So the activities of daily living are bathing, dressing, toileting, ambulating, transferring. Those are the main activities of daily living, and we want to understand how much hands-on care is needed with each of those tasks, or it could be someone who has a mild, moderate case of Alzheimer's or dementia, and perhaps they don't need any hands-on assistance. They just require somebody to remind them to do all of these things or to cue them on how to do these things properly. So we really want to understand to what level this type of assistance is needed. And then come the instrumental activities of daily living. And those are things like transportation, shopping, meal preparation, again, talking about home maintenance, medication reminders, which is a big part of really helping people sort of maintain their ability to stay at home. So then we kind of jump to what services are available to provide us assistance with all of these things. And so we're going to start talking first about some of the community-based services that are available. And why talk about community-based services? Well, generally speaking, most community-based services require, minimal intrusion to the home. We're not talking about jumping in and starting right off with 24-hour care. We're talking about maybe somebody needs to come in a couple times a week for a few hours each time to help with maybe some of the house cleaning, some of the laundry, some of the meal preparation, those types of things, maybe some errands, shopping, sort of thing. The question is, we always want to make sure that we're proactive, and we start things like this before there's actually a crisis and that 24-hour need, right? Because that really can help maintain independence a lot longer than waiting, and then all of a sudden having to jump in because there's been an incident like a hospitalization or a broken bone, something like that. It's easier for someone to accept sometimes having care into their own home than it would be talking to them about making a move and accepting services at a different kind of community. A lot of our area communities now have something called a neighborhood naturally occurring retirement community. In long-term care, you will see we love acronyms. So we refer to that as a NORC. And that's really sort of a neighborhood that didn't start out as an aging community, but over the years, neighbors and individuals who own homes in those developments have aged together. So there's a cluster of seniors that live in close proximity to each other. So a lot of what we want to talk about in that instance is there a way to co-op or share some services. There is a more formal movement referred to as a village movement, and very similar to a NORC, the village movement actually takes it one step further and provides a level of service and information. So depending on each village, so there's several villages in Albany. There's one in Clifton Park. There's one in Fort Edward, Hudson Falls. There's another one in Glens Falls. And what's nice about that village is, generally speaking, there's a membership. And when you require something or need assistance, you will call on one of the other members in that village to help you get to the doctor's appointment. Maybe they're going to go shopping and they'll take you shopping. They'll pick you up and take you shopping with them. So it's volunteer based for the most part. The village movement actually started in Beacon Hill in Boston. And they actually have a very formalized way. They have hired staff that actually perform all the tasks. So lots of ways to kind of access different levels of assistance depending on where you are. So I want to talk a little bit about some of the specific community-based services that are available out there. Again, Dave, just to remind you that Dave said that, you know, there'll be a copy of the slides sent to you, so don't feel like you frantically have to write all of this stuff down. These slides will be sent to you. You'll be able to print them out, look at them, and you know, have them there as a visual for yourself. We sort of talked about home delivered meals. There are different things through the County Office on Aging, like health insurance counseling. It's called HICAP. Why would that be an important thing in helping somebody maintain their independence? Health insurance is huge, so you really want to understand what your health insurance does and does not cover. So often, a lot of times people think their health insurance is going to cover a long-term stay in a skilled nursing facility, and it really doesn't do that. They think it's going to cover home care coming in if we need long-term care coverage. So we really want to understand what your Medicare plan does and does not cover. Also, from a financial perspective, it's really important to understand co-pays and co-insurance and deductibles and things like that. So I recommend every year that folks meet with a HICAP counselor to really talk to them about what their plan does and does not provide for. You know, we sign up for Medicare when we turn 65. Our healthcare difference are much different as we get on into our 70s, 80s than they are when we are, you know, younger. So your health insurance needs to grow with you as well. Home maintenance services, again, there's a wonderful organization called Umbrella that's a membership. It provides for vetted and background checked individuals to do everything from snow plowing to transportation to, you know, electrical work, plumbing work, the different types of things like that. And the umbrella program is wonderful because so often seniors can get scammed if they have a home maintenance need or a home repair need. So this is really one way to assure that that the person that you're bringing into your home is not only vetted and background checked, but they're also not going to scam you out of a lot of your hard-earned money. Another way are both personal emergency response system and medication reminders and dispensers. This is a great way to involve technology in your life. So often we've heard of the help I've fallen and I can't get up button. In addition to having that, they also include a fall detector. So for individuals who live alone, particularly, or live with someone that may have a memory impairment, these fall detector PERS units, we call them, are very, very important. It can make the difference between having a long-term stay in a hospital, nursing home, and the difference of, you know, someone coming and taking care of your medical need immediately. Say you've fallen, you've hit your head, obviously you're knocked out, you can't press the button, or you're living with somebody that has a memory impairment, they may not understand how to call 911 on your behalf. So a really important way to be able to protect your safety. In our area, we have an option of adult day centers that provide both a social and medical assistance for folks who may need a little bit more support. It still allows you to stay at home, but you go to the day program during the day, you get a meal, medication, either reminders or administration for some people. In a medical model, you can get personal care. You can have physical and occupational therapy provided for you there. And then you return home in the evening and with a loved one or maybe with some care. So it really does help provide some support during the day. We're very lucky in our area to have access to two incredible centers for excellence for Alzheimer's disease. These are centers both specific to neurological disorders. So not just Alzheimer's and dementia, but other sort of memory related types of diagnoses as well. Why is a neurologist important? Just like going to a cardiologist or a urologist, you know, it's a specialty. Your brain operates everything in your body, right? So having someone that can specifically work and help you identify some things that may be going on are very helpful. Particularly if you're dealing with a loved one with Alzheimer's and dementia, sometimes there are challenging behaviors that come along with that diagnosis. So working with somebody who specializes in that field really can help you manage the disease from a long-term perspective. Each Center for Excellence, there's one at Albany Med and there's one at Glens Falls Hospital. They each also, in addition to neurologists, they have social workers, case managers, and nurse practitioners that are available to help families as a resource. We're going to talk a little bit about respite programs that are available both for memory-related issues and non-memory-related issues. So Eddie Alzheimer's Services provides respite for our folks with memory impairment. Catholic Charities offers respite for individuals that have a non-memory impaired diagnosis. So respite is simply having the ability to have someone come in for a few hours a day at a time per week to offer the primary caregiver some time to get away and get some respite. We have some fabulous resources for caregiver education and support, everything from education programs for Alzheimer's, for dementia, for really understanding how to de-stress from the caregiving role, providing the ability to have one-on-one consultations with someone who's an expert in that field and really working with you to maybe identify some other avenues of things that you can utilize for working with somebody that may have a memory-related diagnosis. Hospice and palliative care is a wonderful resource in our community that's not used often enough. Palliative care can be sought at the beginning of a chronic diagnosis. It really is intended to help folks that have chronic illnesses, things like congestive heart failure, diabetes, COPD, any type of chronic illness someone might have. Adding that palliative care piece really focuses on the quality of care that somebody's receiving. We're not really necessarily talking about a terminal end to that. It's really talking about the long-term management of that chronic disease and how do you, as someone living with a chronic disease, want to deal with that. So palliative care is a wonderful thing to add to, a wonderful support to add to anyone's care plan. Physical therapy and occupational therapy are really wonderful for helping people maintain independence in home much longer. A physical therapist can come in and help with strength building, particularly if somebody isn't getting out as much and is having some trouble walking. One of the biggest causes for someone having to seek care outside of their home is having a fall. So if we can bring a physical therapist in to help you rebuild some strength, that can really help you maintain independence a much longer period of time. An occupational therapist can come in and help you adapt to your surroundings a little bit better. Maybe they'll look and see where bars might be more accessible or better for you. They may talk to you about a lighting situation. They may talk to you about adaptive equipment that can be used that might make things more accessible in your home. So a great way to really look at maintaining independence a lot longer. And then of course there's home care services, and we'll talk a little bit more in detail about home care services in a few slides. One of the biggest things I think that challenges folks and their independence at home is transportation. It's a very challenging thing to talk to somebody about giving up driving. It does become an issue for most of us at some point in our aging journey. We are lucky in this area that we have lots of transportation options. This list is just sort of a small sampling of what's out there. I wanted to actually talk about one in specific that most of us, it's fairly new in this area. Most of us haven't heard about it. It's called GoGo Grandparent. And it's actually an extension of Uber, What's nice about the Go-Go Grandparent Program is the drivers are specifically and specially vetted for seniors. So they actually go through a background check. It can be arranged by a phone call, so you don't have to have a smartphone or an app on your phone to utilize it. You just pick up the phone and call once you're registered with the program. The nice thing too about the Go-Go Grandparent Program is it actually allows for assistance in and out of the car, in and out to your appointment, which a normal Uber, Lyft, cab, they don't provide that sort of support. Another program that I really like a lot is the CDA STAR program. So that's through the Capital District Transit Authority. For anyone who lives within 2/3 of a mile of a bus stop, the CDTA STAR bus will actually come to your house, your driveway, pick you up, it's a door-to-door transportation service. It also allows for another individual, like a caregiver or significant other, to travel with you. The other wonderful thing about the CDTA STAR program is all of the STAR buses are handicapped equipped. So for someone who's in a wheelchair, they don't have to transfer in and out of their wheelchair. And that's really challenging for folks trying to get in and out of someone's car, perhaps. So the STAR bus really is a nice option for that. So with the CDTA STAR program, you do have to have your physician fill out a form, but it's fairly simple and straightforward. So let's talk about in-home assistance and what does that mean and what does it include? So at the very beginning of home care, usually you might just need a companion service, and that's somebody, technically what we say, it's hands-off care. So assistance with light housekeeping, laundry, meal preparation, transportation to appointments, grocery shopping, those types of things. So a lot of assistance with those instrumental activities of daily living that we talked about earlier in the program. As we graduate, we may have to then move into a more formal home care program with a licensed home care agency that provides hands-on care. So they might provide hands-on care with bathing, hands-on care with dressing, toileting, all of those types of things if someone doesn't have the physical capability to be able to do those things for themselves. Homemaker services really focuses straightforward on managing the household. You might have someone come in and clean a few times a month. You might have somebody that does the grocery shopping and then brings the groceries in and puts them away for you. So the different sorts of services that are focused around keeping your house up. There is a network in our area of private duty aides. Very often we work with families who have had somebody working for them a few hours a day, several times a week, that they've been paying privately under the table. We always want to talk to folks about, their pros and cons to both of those, to having both an agency or a private duty aid in the house. One of the things that we really want to bring to your attention is to make sure that, when you're working with a private duty aid, you understand their background, you check their references religiously, because when they're working private duty, they're not under the umbrella of an agency where they're bonded or insured or taxes are taken out of their pay. So if something were to happen while caring for you in your home, it does put you at a much bigger risk than if you were working with some type of agency. Again, talking about home maintenance, because that becomes a big issue for a lot of folks, is just being able to take care of the simple day-to-day tasks of things that happen or can go wrong. And another wonderful resource for folks in home is if you don't have a family member that can help you with your finances, there are folks that you can hire, and they're called money managers. And we have a couple in our area here that really do provide a wonderful service in helping people make sure their bills are paid on time. They keep track of bank accounts to make sure that people aren't being taken advantage of or being scammed out of their hard-earned money. So the big question is, where do we find all of these services? New York Connects is a statewide organization that works with folks technically from birth to death. So it's one number that you call for county, and it will help you with everything from setting up home delivered meals to maybe transportation, to giving you some information about what home care is available out there, talk to you about different options for insurance, what other subsidies might be available, like HEAP, the Heat Energy Assistance Program, food stamps, different things like that. So New York Connects is always a great place to start. The next slide is really just each county and their direct phone number. There's also a statewide website, if folks are like the web, that you can go to, put in your geographical zip code, and it will list all of the resources that are in your area. So again,
Kim, I'm sorry, Kim, I'm just going to let this slide up there for another minute or two in case someone wants to write a phone number, and you could move on as you please.
No worries. So again, you know, accessing the County Office for Aging really is a wonderful place to start for a lot of folks. They do have programs that are available at no cost to low cost, and lots of different, you know, support services that are out there. So I really encourage folks to tap into your County Office for Aging, because there are lots of things out there that you may not even know that you would be eligible for. Another great avenue and resource to reach out are faith-based organizations. And in our area, again, we're lucky in that we have a formalized system set up for some of our faith-based organizations. Next slide there, Dave. Catholic Charities in our area has care teams set up so that you can access a volunteer care team that will help with everything. You would be assigned maybe a team of 5, you know, 2 to 5 people that would help with transportation, they'll help with meals, they'll help with just maybe giving a primary caregiver some respite, lots of support through these care teams. Jewish Family Services actually provides education programs. They have a center, non-pandemic time, where you can go and participate in activities. And they also have actually a formal, what we call the NORC, the Naturally Occurring Retirement Community, that they actually provide formalized and professional services to. There's a parish nurse program that runs out of St. Peter's Health Partners. A lot of churches have an embedded nurse in their congregation that participates as a parish nurse. And that's someone that you can go to for a simple blood pressure check, to someone who will sit with you and talk to you about maybe some of the different community resources that are available. Also through individual church and parish programs, we a lot of times find individuals who are willing to sort of set up their own informal care team for someone who's in their congregation. Perhaps we set up a team of 5 people or so who are willing to rotate meals through, who are willing to assist with transportation and things like that. So we're always looking outside the box for folks that can help, particularly for someone who may want to stay at home. Some of the other community-based organizations that we utilize are community health centers. Right here in Saratoga, we're very lucky to have a community health center through the Saratoga Hospital. One place where you can get everything. So dental, mental health services, primary care, a urologist, a neurologist, your podiatrist. So you're going to one center for all of your care. You're not having to drive to Albany for this one, or drive to, Saratoga for what, Clifton Park for others. So it's really a great way to mainstream your healthcare all under one roof. There are wonderful senior centers in our area. The Saratoga Senior Center shut down only for a very short time. They do in-person programs now. They provide food through the regional food bank, education programs, exercise programs, all sorts of different kinds of interactions for folks. Colony Senior Services down in Colonies, the same thing. a lot of in-person programs, online programming as well for their folks who may not be able to get out, or when we have the issue, of course, of the pandemic, where not everybody can be in the room together. Hopefully that will be changing at some point. Lots of wonderful nonprofit organizations as well. The Alzheimer's Association provides services to our regional 17 counties in the area. They do education programs, care consultations for individuals and family members that are dealing with Alzheimer's and dementia, respite. There are 24/7 helpline. So somebody may have a challenging issue at 2 o'clock in the morning with a loved one. They can call that 24-hour helpline and talk to a live voice that may be able to help them through that situation. I mentioned the Eddie Alzheimer's services earlier, in that they provide a respite, caregiver respite program. Legal aid is always a wonderful option for folks who may be challenged with some legal issues and can't always afford an attorney. And we have a wealth of independent living centers. Also, our one up north in Queensbury actually has a loan closet where you can get everything from a hospital bed to a wheelchair to ramps, all different kinds of equipment to kind of try on a 30-day period. If you have a crisis or emergency and find yourself without something and needing something, or you're not quite sure the piece of equipment you might need, they have access to be able to try that out. So lots of great options for folks. So naturally, when we talk about long-term care, we have to talk about costs, and really want you all to understand what each level of long-term care consists of and how much it costs. You know, home care, where most people want to be, really can come from many different ways. It can come unpaid, and that's what we consider an informal support service. So family, maybe neighbors, children, friends, different things like that, up to paid home care. And we talked a little bit about private duties and professional organizations that provide home care, but you can expect from a licensed home care agency to pay about $30 an hour, you know, for home care. And that gets very costly very quick. Assisted living is actually a wonderful model. You have your own apartment where you reside and you get 3 meals a day. They will manage your medications for you. They will manage your medical appointment needs, transportation, those different kinds of things. And assisted livings in our area can range anywhere from about $3,000 a month to $8,000. The reason for the big discrepancy in price is a lot of them offer what we call a tiered program. So you may go in at a level 1, so your price is going to be much lower than it would be if you went in at a level 3 or 4. And they provide services, you know, incrementally as your needs grow. A memory care facility here in our area can cost up to $10,000. And memory cares really are wonderful because they really are designed specifically for our folks that may have cognitive issues. And of course, there's nursing home, where none of us ever want to be, but really have to understand that in our area, they're going to average you between $14,000 and $15,000 a month. So, you know, as witnessed, long-term care can get expensive very, very quickly. So what are the funding sources available for long-term care? Of course, there's private pay, which is out of your pocket. The County Office on Aging, which we talked a little bit about, that they have some funding available for some of their caregiver support programs. There's something called ISEP, which is, it stands for Expanded In-Home Services for the Elderly program. That's a few hours a week of care. So there are different opportunities through each County Office on Aging, depending on where they are in their budget year and what they have available. Of course, there's Medicare and Medicaid, and Dave is actually going to talk more specifically about those in a few slides. There's long-term care insurance, and the reason I mentioned that is so often we work with folks who may have a long-term care policy, but they're sort of saving it. And I use the air quotes saving it because when I ask, well, what are you saving it for? And a lot of times folks will say, well, when I need it. And if you're talking to us about long-term care or that you've had an incident, you probably want to understand what your long-term care policy covers. Does it have an elimination period? You don't want to be investigating what all of the benefits of your long-term care policy are when you actually are thinking that you need it. A lot of the policies come with an elimination period. It can be 30, 60, 90. I've even seen some that are 180 days. The last thing you want to be doing is paying out of your pocket for 120 days if it's 24-hour care, right? So we want to think about what types of how we can utilize that long-term care policy prior to that. Again, we've talked about some of the respite and caregiver support grants that are out there, both through the Alzheimer's Services and Catholic Charities. The thing that I'm going to spend just a little bit of time on are veteran benefits. It's one of the most overlooked options that are out there. And anytime I'm working with somebody that is a veteran, I really am recommending that they access the VA for any of the services that might be of use to them. So, as far as home and community-based services, the VA can provide everything from adult day program. They have a home-based primary care program where the doctor actually comes to your home as opposed to you having to go out for the doctor. They do have the ability for homemaker and home health aid care, hospice care, palliative care program. There are some respite programs available through the VA. They also offer some of that remote monitoring care, so blood pressure. They may be able to offer the personal emergency response button that we talked about earlier. And then there's something called veteran directed care, where it allows you a stipend to hire somebody at your discretion. I'm going to talk about some of the programs that are financially available to assist with home care. So there's a compensation program, and that compensation program is attached to what we call a service-connected disability. So a service-connected disability is a disability that's related to your active military service. Your disability is assigned like a rating, a percentage. So from 0 to 100% based on how severely your disability impacts your daily life. Your disability has to be connected directly to the service that you had. So I will give you an example. My dad served in Vietnam, and he has multiple chronic diseases, and it's all contributed to his exposure to Agent Orange. So my father receives a service-connected compensation. So he gets a monthly check from the VA due to his service-connected disability. So it's a little bit different language for folks, and it's becoming more common, particularly with our Vietnam veteran era vets. The next would be a veteran's pension, and a veteran's pension, it's a tax-free monthly benefit, and it's for low-income wartime veterans who also need to meet some of these other criteria. 65 or older, they have to be totally and permanently disabled, living in a nursing home and receiving skilled nursing care, or receiving Social Security disability, or receiving some type of supplemental security income. So it really is designated for our lower income vets. One of the more popular programs that a lot of folks talk about is the aid and attendance. And really the aid and attendance, the wonderful thing about aid and attendance is it's not only available to the veteran, but to the veteran's spouse. So you would qualify if you require the help of another person for everyday personal care needs. So those activities of daily living, such as bathing, dressing, toileting, those types of things. Bedridden, you're automatically eligible if you live in an assisted living facility, because the assisted living facility is providing some of those activities of daily living to you. And it provides for a monthly stipend. So most of our folks would be eligible from anywhere from about $1,300 to $1,700 a month to help assist and pay for care. So a lot of really wonderful options for accessing the VA. So always encourage people to access those programs. Handing it over to Dave at this point to talk about Medicare, Medicaid, and what they offer. And I see a chat, so I'll answer that question and we'll go on from here.
Kim, thanks so much. I only wish you were a little more thorough and knowledgeable about all these different kinds of services. We got to work on that. So one thing Kim mentioned on the aid and attendance, I just want to point out. So being a veteran is not enough for some of these programs. They define whether you qualify as to when you served. Thank you, everyone who served, by the way, obviously. But it does need to be in what they would consider active duty during wartime, and there's different ranges of timelines for what that exactly means. So like everything else that Kim mentioned, and like everything I'm going to mention right now, devil's in the details, all right? You can't go to a webinar or seminar and have all the answers, but these are good things to look up and get more information on. One of the things that Kim mentioned was Medicare, and Medicare is health insurance. It's health insurance for those who are 65 and over. And health insurance is not for long-term care. Health insurance is for health care. Makes sense, right? And healthcare, in my little brain here, I define healthcare as being things that get us better. And that helps me remember what role Medicare can fit into a long-term care plan, because I know people, and you may know people, who've had some sort of illness or a fall. They ended up going to the hospital. They're older, right? And they went to the hospital, and from the hospital, where did they go? They went to rehab. The rehab was in a nursing home that has rehab. And sure enough, Medicare covered that rehab, and then they were rehabilitated, they got better, they went home. Medicare covered the whole thing. But the truth is Medicare does not cover long-term care, and there's always this dispute. Well, my neighbor, right, they had this long-term care event, they went home. That's true, and it can work out. The reason why it can work out is because Medicare provides certain amount of help for rehab, getting better. Up to the first 20 days after you've been in a hospital, admitted for 3 days. So you got to be in the hospital, admitted for 3 days, at least. Then you need to go to rehab. That rehab, at least up to the first 20 days, may be covered in full by Medicare. You heard that right, in full by Medicare. It's better, I guess, or worse, depending on how you look at it. Days 21 through 100, the next 80 days, Medicare can cover just about everything. Now, everything is really expensive. So when I say just about everything, that little amount that they don't cover ends up being about $185 a day is your copay per day, days 21 through 100. So over the course of a month, that's well over $5,000 a month. So that's still an issue that we're going to have to come up with some money. But it's good to know they're going to be providing a lot of services up to the next 80 days. After 100 days, they're saying we're not going to provide you with any more services in that rehab. Now, I'm an attorney. I got to be real careful with my words. I said up to, and the reason why it's up to the first 20 days, up to the next 80 days, is because at any point, your loved one may refuse services, meaning that they're no longer accepting rehab, which means they're no longer getting better, which means it's no longer a health insurance thing, a Medicare thing. And it could also be because they plateaued in their recovery. At some point, mom's got a bad hit, and that's the reality. At some point, dad has dementia, and there's no amount of rehab that's going to help him with that specific long-term care need. So it's good to know what Medicare can do. It's also really important to not depend on Medicare, even though it's so easy to confuse it with the next term that we're going to talk about, which is Medicaid. And there it is, Medicaid. So Kim gave me all of 8 minutes. I'm kidding, Kim. I wish you took all hour. We have whole webinars, guys, whole webinars on the Care at Home program. There's something called Community Medicaid. It's our Aging in Place seminar, or sometimes it's referred to as a Community Medicaid update. You should look at that webinar. Okay, I'm not going to be able to cover that in the next 9 minutes. What Medicaid is, or at least a portion that we care about of the program, is a federal program that has a fantastic long-term care program if you qualify. This program, which is federal, is operated state by state. Each state has slightly different rules as to how they'll employ the benefits they're receiving under Medicaid. Each county in New York, in fact, is a little different in terms of how they interpret the rules and what they look at to see whether or not you qualify. And of course, it's very, very fact specific. The idea of the long-term care program under Medicaid, though, is for 65 and over, sounds familiar, just like Medicare, where there's a long-term care need, and when you meet the means test that they have, both resources or assets, as well as income, we check off both those, we're able to qualify for this program. And depending on whether it's a home care program or a nursing home program, which is primarily where Medicaid will cover you, there's drastically different qualifications as well as look back periods, right? How do we plan for eventual needs for these kinds of services, okay? Now, you see here, it says home care, adult daycare, assisted living, right? That's for community Medicaid. And those of you who are pretty sharp say, well, wait a minute, you said nursing home or home care, and now it says assisted living. How does that work? Well, there are certain assisted livings that may accept your loved one and take Medicaid as a form of payment, but they take Medicaid under the home care rules rather than the nursing home care rules. And there's a couple in our area that we could talk about at another time. In terms of what Medicaid cares about, and now we're just doing a snapshot on the home care, the community Medicaid program, all right? In terms of income, we're talking about $904 a month of income. In terms of assets, we're talking about just under 16,000, and that's for a single individual. Dad is a widower, he needs help at home, right? He needs help with some activities of daily living. Now, before we shut off our screen and say, I can't believe I wasted all this time, $900, of course, everyone's got more than $900 of income. $16,000 of assets, well, you know, my bathroom is worth $16,000, let alone my whole house. Well, the devil's, of course, in the details there as well. So first of all, it's important to know that when we talk about assets, what we're really talking about is something called resources, okay? And I define resources to be those things that you, with just your signature, can get your hands on, okay? That's what a resource is. That's what Medicaid cares about, which means if you cannot get your hands on something with just your signature, that thing is technically not a resource, or at least not a resource to Medicaid. Surely it's an asset. So what are we talking about here? Well, the types of things that are resources, and this should make sense. Bank accounts. Why? Well, you can go to the bank, sign your name, and pull out a bunch of money. CDs, savings bonds. You could sign to cash those puppies out. Your stocks, your bonds, your brokerage accounts. Why? Because you could call someone and say, buy, 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 sell, 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 and go get all your money out. Your home could be a resource in certain instances, but in the case of home care, your primary residence will be exempt. In the case of nursing homes, it likely will not, because you could technically sign that deed to sell that house tomorrow and use that money for your care, okay? Cash value in life insurance above a certain amount is considered a resource. Why? Same idea, guys. You can access money with just your signature. I need to focus on that last phrase of it because that's going to help us talk about how to protect our money, okay? So they care about the stuff that you can touch with just your signature. There's a couple exceptions here: your primary residence, burial plots and prepaying funeral expenses, small life insurance policies, one car of any value. I had a client down in Kingston where if it had to come to it, he was going to have a very expensive car as his one exempt automobile. It ended up selling prior to his needs for $1.5 million. I promise you this is true. And most importantly, your retirement accounts. Your retirement accounts do not count as a resource. They're not an asset for purposes of Medicaid. I got to use these air quotes as well if you could see me. Why? Because they're something else. They're considered income. Okay, so let's just go back a slide here and, oh, excuse me. Oh, where am I going here? I'm all over the place. There we go. Okay, let's just take a quick peek at these numbers again. So assets, 16 grand, but we know we could have a house, we could have $1 million retirement account, and we're still under the resource amount. We also know for home care, there's no look back period. So we could actually move things around today and you qualify March 1st. That's definitely an asset of the Community Medicaid program. I do want to focus on the income for a second here, though. Income's $900 a month, and most people, just their Social Security alone is well over that $900 a month, and then we factor in pensions. We factor in distributions from the retirement accounts, which are considered income as well, those required minimum distributions that Medicaid will make you take. Well, the government makes you take in general. Medicaid makes you take it if you want to qualify for the program, even if you're under the age of 72, which is when everyone else takes their required distributions. Well, on income, that's tough because if we're living at home, we still have our home expenses, right? We're on a fixed budget. We long-term care comes when we're in retirement for the most part. So we have this added expense that Kim's been talking about. Thankfully, there are those programs that she mentioned. But inevitably, we have to pay for caregivers for a lot of care. And that expense comes at a time where we have no other income other than our retirement income. We're on a fixed budget. So if we just limit ourselves to $900, if that's really all we're allowed to have, even if we can get care at home, we probably cannot afford home, right? What about the taxes? What about insurance, utilities? Can I have food? Can I have clothing? What if my boiler breaks, right? What do we do in these instances? And thankfully for home care, and I'm kind of going to speed around here. For home care, there's a way to make it affordable. And again, I apologize because we kind of have this hour timeline. There's so much to cover, and there's no way we could cut Kim off of all that valuable information. I do want all of you to attend Aging in Place or Community Medicaid Update, or come in for a consultation, or call us, or do a Zoom for a consult. But for home care, there's something real special that New York does for its residents. It offers people the ability to set up something called a pooled income trust. And what that does is it allows people who have income well over $900. Let's say your income is $2,900 a month in income, right? That extra $2,000 you have above what Medicaid allows you to have, what Medicaid says is, you know what, you'll qualify even though you have $2,900 a month, but we want every month for you to give us the first $2,000 for the caregivers, and then we'll cover the rest. It's like a deductible, except it's a monthly deductible. And that does not allow people to stay at home because home is expensive too. Thankfully, we're allowed to do a pooled income trust. What we do is we enroll our clients in this trust, and every month, instead of paying for the caregivers at $2,000 a month before Medicaid does anything, our $2,000 goes to a segregated pool trust operated by a third party. And then we have family members, right? Your daughter submits to that pool trust your expenses, the home expenses, the utilities, right? Maybe you have a rent obligation. Maybe you're living in an independent senior facility, right? Where, or community, excuse me, where there's rent. You can have your own money pay your own expenses for your own home, your own needs, while still qualifying for Medicaid. It's 3:01, guys. We're at the 1 hour mark, and this is kind of a hard stop for us. So I apologize that I wasn't able to go into all these other slides left and right over here about Medicaid trusts and so on. As we mentioned earlier, these slides will be provided to you. Some of them will be utter nonsense because you didn't hear any descriptions of them. And that's where I direct you to our website, www.herzoglaw.com. You can go to the seminar webinar page of it, and you just look right down there. You'll see webinars that are available for you. You can see seminars that are upcoming. The times don't work for you. Look at all the ones that have been recorded. They're all available. They cover every topic we've ever done. Okay. You could email us at info@herzoglaw.com. We could send you slides. But I do want to caution you, everything that Kim said, everything that I very quickly said, and anything you hear in the other webinars, it's good general information. It means nothing until it's applied to your specific fact pattern, okay? You can retain Kim's services without retaining us to do a Medicaid application, okay? You could retain our legal services without having anything to do with Kim. We can bifurcate everything. We could single out certain services we provide, but the fact is that your facts matter the most, your needs and your wishes, your desires, all that stuff. And I highly encourage you guys to come in, whether Zoom, phone, in person, at our Kingston office, Clifton Park, Albany, Saratoga Springs. We are now starting to do more home calls, and we're feeling a little more safe out there. So we'd love to help you get answers to your questions, fill in a lot more of the blanks. I apologize, we can't go more into it today. The rest of this week, guys, at 2 p.m. every single day, we have a new webinar. All of them are available on demand as well. I thank you guys for joining us. Thank you, Kim, for providing such a in-depth summary. And truly, it's just a summary. It's just the tip of the iceberg of the different services that are available to everyone. And thank you so much. Take care.